again for coming out to an update on COVID-19 situation in New South Wales, but also to hear today from Dr. Kerry Chant, of course, is the Chief Health Officer here in New South Wales, Professor Kristine Macartney, who was a paediatric infectious diseases expert, and we'll have some information from her in due course. She's also, by the way, from the National Centre for Immunisation and Surveillance. It's a federally funded body that works, it's a preeminent organisation that works in this area of obviously epidemiology and virology right across the world. And also Mark Scott, who is the Secretary of Education of the New South Wales Education Department. So, up till 8 p.m. last night, we've had 8 more cases, which indicates again we're keeping in fairly low numbers. Yesterday, you recollect, we had 12. In the previous 3 days, I think it was 2 days at 5 apiece and 1 at 6. So New South Wales is still doing extraordinarily well. So I want to thank the community for heeding the message of social distancing. It's the single most important thing you can do. Just stay at least 1.5 metres away from everybody, including the journalists who are a little close at the moment. Separate a little bit. And make sure that you follow good hygiene. Washing your hands is the second most important thing you can do. And just keep doing it. When you think you've done it enough, do it some more. As at 8 p.m. last night, that extra 8 cases has taken us to 3,002 cases right across New South Wales since the COVID-19 issue started. Testing has been fantastic. I'm so proud to be in a state where so many people, so many residents have been prepared to put themselves forward for testing. And I'd like to thank our pathology services and our health staff, who are just doing an incredible job at the front line. I visited a COVID clinic yesterday on Anzac Day and spoke to some of the staff. They're there in their personal protective equipment, despite it being a public holiday, and doing their very best to keep people safe. So thank you to all of those staff who are day after day doing what we need as a community here in New South Wales. Total testing to date, 198,715 people. So we're closing in on 200,000 people, which is an amazing effort from all of our health staff, but all of our community. Of those who've been tested, of that 198,715, 195,713 have tested negative. So it reminds us that whilst this is a particularly difficult and challenging virus, we also know that it still hasn't managed to get through the community in New South Wales, indeed Australia, to the extent that it certainly has in other jurisdictions like Italy and France and Spain and the UK. Sadly, up to 8 p.m. last night, there was one further gentleman who passed away, an 82-year-old gentleman, and I'll ask Dr. Chant to say a little more about that. But again, we all know what it's like when you lose a dad or a granddad or a brother. I just want to say our sympathies are with that gentleman's family, and all of us, I'm sure, the entire community, express our condolences to the family of that 82-year-old gentleman. I want to stress that of the 3,002 cases, 2,208 people have fully recovered. So that's a very positive message to our community that despite the very great contagious nature of this particular virus, by far the bulk of people are actually recovering and doing very well. At the present time, 303 people haven't recovered, and of course we're up to 36 people who've passed away. But we're still working on the other 455, New South Wales Health and the amazing staff that are up here on a particular floor in this building, joined by ADF members, Air Force, Army, Navy, are doing the tracing work, the important tracing work. It's a very, very difficult and challenging and arduous job to manually contact every individual and then every individual who might be a contact. So thank you to all the staff who continue to do that. There has been a medical practitioner at Nepean Hospital who has also tested positive. Fortunately, she had not been in the relevant period. Most of you would now know that for vulnerable populations, we go back at least 48 hours from the time symptoms arise. That particular medical practitioner had no face-to-face patient work, no clinical work in that preceding 48 hours. So she did have two contacts that we know of at the hospital in the relevant period. So those two other medical practitioners are also now obviously doing what we've all learnt that we should do if been in possible contact with someone who's got COVID-19, and that is they're having 14 days isolation. And of course, they'll work through that. If any symptoms arise, then the next stage would come up, but hopefully there won't be any symptoms. I want to point out that that particular doctor also worked a shift at the Sydney Adventist Hospital, but again in a non-clinical position, so wasn't actually working in the relevant period with patients. So that's also very good news. That means that we've had 8 staff who have been in isolation in that particular facility at the Sydney Adventist Hospital. So no patients, but staff. And can I say that it was a mixture of medical and non-medical staff. They're all doing extremely well. There's no indication at this stage that they're ill. So that's a very positive outcome. Before I hand over to Dr. Chant, I just want to say today a report has been released from the National Centre for Immunisation and Surveillance. And as I said, Professor Kristine Macartney, who is a paediatric infectious disease expert, will address this in a moment. But the short message to the community is this particular report indicates that schools are amongst the safest places to be. And that obviously is a very important message to all of us who are parents, all of us who I was an ex-teacher, I was a teacher many years ago, and to the teachers and to parents, you should know that the clear message from this report is schools are very safe places to be. Now I'm going to ask Dr. Chant to make some comments, and then I'll ask Professor Macartney and then Mark Scott, the Secretary of New South Wales Education. Thank you, Dr. Chant.
Thank you. In relation to the update in the numbers, there's currently 182 COVID cases being treated by New South Wales Health, and this includes 19 people being treated in intensive care units, with 15 of those requiring ventilators. 80% of cases are in non-acute or out-of-hospital care. As the Minister mentioned, there has been one new death, an 82-year-old male, resident of the Anglicare Newmarch House, and this brings the total number of deaths linked to this facility to 6, and that brings the overall deaths in the state to 36. In relation to the Boddington aged care facility, I would like to emphasise that the aged care worker did not work whilst she had any symptoms, but as a precaution we go back a period of time in case there can be transmission before the onset of symptom onset. Pleasingly, the 20 residents in the wing where this healthcare worker worked have all been screened, whether they had symptoms or not, and those test results have come back negative. And we're also undertaking extensive testing of all of the healthcare staff and should have those results available later today. And I'd like to express my appreciation for the prompt response from Boddington and their extensive cooperation in this investigation. But as I wanted to indicate, there's no evidence of an outbreak at this facility at this time, but we will certainly keep you updated on that. Just as a bit of a prelude to the talking to Kristine Macartney and Mark Scott, I thought it's useful to reflect on the number of cases in children aged 5 to 17 years. We've had 52 COVID cases diagnosed in that age range of 5 to 17, and 52% of those acquired it from a household member, followed by 31% who acquired the disease overseas. In general, the disease has been quite mild amongst the children, and there were 3 hospitalised. One was isolated predominantly for isolation. The one had child had underlying health issues and one for an other concurrent illness. Thank you.